Hi guys. Um, I had some feedback that said that sometimes I am a little clearer than other times, and sometimes I'm too loud, so I will try to stay at the same closeness. I think maybe it was me getting too close to the mic or too far away. So we'll see how that works out. I just graded your exams and those turned out pretty good. Most of you did fairly well. I think there was only one question about um, the microorganism that commonly causes abscesses is strep instead of staph. And I know that that seems really weird, but that was the only one that most of you missed. And then some of you missed the essay questions. So, but overall, everybody did really good. And so thank you for getting that done. And let me know if you had, I talked to a couple of you, so let me know if you have difficulty. Today we're going to talk about chapter 5, and this is our second unit of 4. So you guys, at the end of this unit, will be halfway done. So way to go. And so I'm going to share my screen with you here, and we'll get started. All right, so this is chapter 5. This is immune system diseases and disorders. I'm going to get rid of myself here. And this is all about common diseases and disorders of the body systems. This one is the immune system. And so we're going to talk a little bit about that. I'm going to try to let you know the things that you need to know for the exam, because some of these things are more nursing based, and so therefore just a little bit above where you guys need to be. But I wanted you guys to have a basic knowledge of how the immune system works, so when you're talking to your clients, you'll be providing them with the most accurate information. So let's talk a little bit about anatomy and physiology. So there are different organs of the immune system: the thymus gland, bone marrow, lymph nodes, spleen, liver, tonsils. Years ago when I was a child, and I don't know about you guys, but they took everybody's tonsils out. And now, of course, they don't do that because they've realized that they help with immunity. The spleen is another one that can be removed, but also it works with our immune system. This is just a good picture to kind of give you guys a visual, because some people are visual learners of the immune system. So there are two basic responses when something happens. We have a specific response and a non-specific response. A specific response is a specific antigen and antibody reaction. So that would be like if somebody gets chickenpox and you've had it before, your body's going to send out the antigen for that, the specific, very specific thing that's going to kill that, because it knows what it is and it knows how to do it. A non-specific response would be, oh, I hurt my leg, or no, let's say I get a splinter and it's stuck underneath my skin. So the body doesn't necessarily know what's causing the problem. So it's just going to inflame the area. It's going to cause it to hurt. It's going to have some phagocytosis in there. The skin's going to swell up. It's going to start to ooze. It's going to have some secretions in there. And keep in mind that typically our skin is our first line of defense. Types of immunity, you don't really need to know these specifically. I went ahead and left them in here, but these aren't something you specifically need to know for the exam. This is the same as the slide before, but again, it's for visual learners. There's active immunity, naturally acquired immunity, passive immunity where mom passes her immunity to her baby, and naturally acquired immunity and artificially acquired. So the passive immunity from mom to baby is naturally acquired. Artificially acquired would be your vaccines and immunizations. Active immunity would be, I got the mumps in 1979, which I didn't, but that would be, and now my body has an active immunity that's naturally acquired to the mumps. Signs and symptoms vary depending on the organ that's involved. It's related to factors such as if you're immunodeficient, for people who have HIV, autoimmune disorders, people who have different autoimmune disorders can have impaired immunity. And then there's something called isoimmune, which is immunity against other humans, but you guys don't really need to know anything about that. They're going to do tests. They're going to do skin tests, desensitization tests, blood counts. ANA is testing for things like lupus. Rheumatoid factor is checking for things like rheumatoid arthritis. There can be, for immunity, hypersensitivity disorders, which would be allergies. Urticaria is just more like an itching. Contact dermatitis would be like the rash that's associated with that. You can have an elevated eosinophil count, which just means that you're having an allergic reaction. Redness, heat, swelling, itching. We've all had this, I'm sure. Maybe you guys haven't, but most people have at some point in their life. Runny nose, coughing, sneezing, wheezing, and nasal congestion. Hay fever is just a reaction to an allergen in the mucous membranes of our nose and our respiratory tract. It can lead to other things, but typically this is just an allergy response. Symptoms are the same as the other. Many causes of hay fever: trees, grass, ragweed. Causes of non-seasonal might be dust mites. I'm allergic to dust mites. I'm not actually allergic to the dust mite themselves, but I'm allergic to the dander that they leave behind. Pet dander, food allergies. Speaking of food allergies, I had my daughter has eczema, and the allergist thought that it was an allergy, but he wouldn't test her for allergies when she was real little, because he said that studies have shown that if you withhold whatever it is that they're allergic to, that can cause like anaphylactic responses. So like kids who are allergic to peanut butter, but they didn't have a severe allergy, but if we withhold that it can develop into a severe allergy. So here it talks though about removing the allergen, air-conditioned environment, antihistamines, and allergy desensitization. That's what they do with allergy shots. They're just desensitizing your body to that allergen. So they're giving you little bits of it over time so your body can build up that specific response and it'll know what to do when it gets exposed. All right, asthma. This is most commonly known as bronchial asthma. It happens in the bronchi of the lungs. Symptoms are going to be extreme shortness of breath, difficulty breathing, wheezing, anxiety, cough. This is very scary for people. We want them to avoid the causative allergens. Again, desensitization to whatever's causing their allergy, education, and medication. There is no cure for asthma. It can be controlled, but there is no cure. Anaphylaxis is something we want to avoid at all costs. This is a severe allergic response to an allergen. It can happen from all of these things and more. It can be mild to life-threatening, usually itching of the throat, swelling of the throat, their tongue, their scalp, their face will get red and swell, but the thing we're worried about most is airway. The very first thing they teach somebody in nursing school is to think about ABC. Airway is always your number one thing to look for. They may have to have a trach placed. They're going to give them epinephrine. Those are those epi shots that some people carry with them, corticosteroids, and antihistamines. But people die from this. This is very serious. Food allergies. Oh my goodness, there's so many food allergies out there. And I think they're just becoming more and more. So just keep that in mind if you're transporting clients or you're with clients. That would be one of the first things when I'm taking somebody somewhere that I would want to know, do they have a food allergy? They can get cramping, diarrhea, vomiting, and they can get anaphylaxis also. Contact dermatitis, this is just going to be that skin reaction that I was talking about earlier. That can come from all of these things that are listed. The most common, I think, in young children is laundry products. And then the next would be medications. Yeah. What do you need? What do you need, babe? Okay, hopefully that just was a intermental pause there. My son had a question. So we talked about these. Get back to the screen here. Rheumatic fever, this follows group A strep infection. My mom had this when she was little. So just keep in mind that rheumatic fever can follow strep if it's not treated. And it occurs 1 to 4 weeks after a strep infection. It's usually sudden or can be gradual, but these are usually untreated strep infections. And there are a lot of people out there who get strep and are untreated. They don't know they have it. They think they just have a cold, and then it goes away, and here comes rheumatic fever. In my mother, it caused her a permanent heart murmur that she's had for the rest of her life. Rheumatoid arthritis is an abnormal antibody that attacks or attaches to the body's own cells and tissues. The rheumatoid factor antibody is in the blood, so that's how they check for this. And ulnar deviation is it's just, I'll try to find a picture of that for you guys, but that's just the classic sign of rheumatoid arthritis. It's in their fingers, and they start to move to the side. It can affect their fingers, wrists, elbows, feet, knees, most frequently. Oh, I forgot that I had a picture in here of this. So here you go. This is the deformity that they're talking about. These nodules that you can see on the top of their hands, and they can also get tendon rupture, because if you think about how their hand is turning to the side, it's very painful for them. They're going to have fever, joint pain. They need accurate diagnosis of strep infections, and they can have surgical joint replacement. I've never seen surgical joint replacement done, ever. But I'm assuming it's out there. They're going to have anti-inflammatory medications to take down the swelling, pain medications. DMARDs are disease-modifying anti-rheumatic drugs. These are certain things, a different class of medications that they use to treat rheumatoid arthritis. And then they have biological medications like Humira and Enbrel. Exercise, rest, short-term corticosteroids. Here we have myasthenia gravis. This is a slow onset. They're going to develop drooping eyelids, double vision, difficulty swallowing and talking, and they're going to have a hard time with their facial expressions. They're going to be very, very tired. I have seen this in my career. They will have periods of remission and exacerbation, and what that means is remission is they're going to get better for a time, and then it'll come back again, and they'll have it again. They're going to take cholinergic medications. They might try a plasma exchange. Then we have lupus. There are 2 types. You really just need to know that there's lupus and that it affects multiple symptoms, and it's a diffuse, typically it's a diffuse problem. There is a cutaneous one, but I've never seen that, and so I just really want you guys to know that lupus is an autoimmune disorder. Here is the butterfly rash that is pretty characteristic of lupus. I have seen this on people also, and it's not always this pronounced. It might be just very, very faint red rash that looks like a butterfly that goes across their nose and under their eyes. They're going to have weight loss, fever, joint pain, and this one also will have periods of remission and exacerbation. They're going to take anti-inflammatories, things to help with the fever, pain medications, and again, corticosteroids to help bring down that inflammation. Scleroderma is a hardening, thickening, and shrinking of the connective tissues. I've only seen this once in my career, but this is mostly the skin. Again, with these autoimmune disorders, most of them have periods of remission and exacerbation. Their joints are going to get contractures. They're going to get Raynaud's phenomenon, which is just when your fingers, at the tips of your fingers, will get white and cold. They'll have thick, leather-like, shiny, taut skin. And I think I have So this is Raynaud's phenomenon. It actually can be white, then it'll turn blue, and then finally red as the blood flow returns. There's no cure for scleroderma, and they may use antibiotics. They're going to throw everything they can at these things to try to help the person. So isoimmune disorders, this is the one I was telling you guys that you don't really need to know a whole lot about. I guess you know, I do want you to know that, and this is on your exam, I know for sure, that type O is the universal blood donor. You need to know that. What is the universal blood donor? And type AB is the universal blood recipient. So what that means is if I am type O, I can go to the blood bank and I can give blood, and they can take my blood and give it to somebody who's B positive. Actually, it's O negative is the universal blood donor, and AB positive is the universal blood recipient. But there can be transfusion reactions, and they usually pre-medicate with ibuprofen and Benadryl before they give somebody a blood transfusion to help prevent some of these things. But you guys do need to know the universal blood donor type and the universal blood recipient type. So somebody who is AB can receive blood from A, they can receive blood from B, and they can receive blood from O. Of course, most people know that when somebody gets an organ transplant, that they can reject that. When we're talking about immune disorders, there are some people who have their immune system just does not have the ability to protect them against whatever disease is going on in their body. So they can have some acquired types, maybe due to bone marrow suppression from chemotherapy. This is preventing their body from being able to fight off whatever it is they may get. Medications given to organ transplant recipients, and then AIDS. So there is treatment now for HIV and AIDS. I think it's more for HIV before it gets to the AIDS portion, but it prevents people from dying. But what people were dying from back in the 80s and 90s was not the actual HIV. I mean, that's ultimately what killed them, but it was the viruses or whatever, the pneumonia and things like that they would get because their body just could not fight it off. AIDS is due to the human immunodeficiency virus. It essentially takes away somebody's lymphocytes, their ability to fight off infection. And it has to enter the body and the bloodstream, and it's very fragile and easily killed. In previous times, I've always told the classes that I was never very much afraid of HIV, more hepatitis C, because it can live on a surface for a long period of time. HIV is instantly killed when it hits the air. There are still many misconceptions. You can't get HIV from toilet seats, doorknobs, water fountains, kissing, sharing utensils, air, food, urine, feces, water, none of those things, because like I said, once it hits the air, it's dead. Spread 3 ways: sexual intercourse, needles sharing, and in utero from infected mother to unborn baby, or in a hospital setting where a nurse or a physician sticks themselves accidentally, and that does still happen. There are different stages. You don't need to know the stages for your exam. I just left them on here because it's kind of interesting. But now I'm not exactly sure. I need to do a little bit more research into where that medication that's out there now for treatment. It's not a cure, because my understanding is the person still has the HIV virus. It's just in a dead state where it can't be transmitted to somebody else actively. But I'm not for sure in which stage that kills that. But once it progresses to AIDS, they're severely sick. They're going to have rapid weight loss, sores, pneumonia. Their body's just not able to fight anything off. And you have to think that in some of these third world countries, they're not able to afford this treatment. So there are still people who are dying from this. And prevention, avoid the HIV virus. All right, so that's all for this one. If you guys have any questions about this, be sure and message me or put it on the questions part of this unit and let me know, and then I will move on to the next one. And I think I've told you pretty much everything that is on the exam, but I will post another exam review, so just be sure and let me know if you have any questions, and we'll move on to the next one. Have a great day.